Hi, I'm Gigi, a psychotherapist and trauma specialist. I'm a member of Counselling Directory. In this short video, I want to answer some of the common questions about complex post-traumatic stress disorder, also known as C-PTSD. So what's the difference between PTSD and complex PTSD? Well, PTSD is often the result of a single traumatic event, and complex PTSD, on the other hand, arises from prolonged or repeated trauma, often during our early years and in situations where escape wasn't possible. This is also known as developmental trauma, a trauma that occurs whilst the nervous system, the brain, and the sense of self are still forming. What this might look like and include is repeated ongoing emotional neglect, physical or sexual abuse, living with a caregiver who was frightening, unpredictable, or unavailable, just to name a few. Now, this type of trauma doesn't just affect our memories, it fundamentally impacts your sense of safety, your sense of identity, and your ability to connect. Many clients don't often identify with one big trauma, but they describe their whole early life as feeling unsafe, and this then trickles into their adult life, and that tends to be the nature of complex PTSD. So how do PTSD and C-PTSD symptoms differ? Well, both share the core symptoms of PTSD, which are flashbacks and nightmares, avoidance of trauma memories, hypervigilance, being easily startled and afraid, emotional numbness and detachment. But C-PTSD has additional layers to it, shaped by the long-term trauma. Emotion dysregulation is one, so difficulty managing our emotions, feeling overwhelmed or shut down. A negative self-concept, feeling shame, self-blame, or a deep belief that you're broken or unlovable. Disturbances in your relationships, so you might have an intense fear of closeness or abandonment or difficulty trusting. And dissociation, so feeling disconnected from your body, emotions, or even reality at times. It's important to know that these symptoms are adaptive and they're necessary for you to survive the repeated and prolonged threat. Dissociation, for example, develops as a protective mechanism. So when fight or flight isn't available or an option for us, and if we can't physically escape, we tend to mentally escape, and over time this becomes a coping mechanism for us, often displaying in our adult lives. So how might C-PTSD affect my daily life? How might it show up? As we know, it doesn't just affect your past, it shapes our present. So many people struggle with chronic self-doubt, self-identity confusion, emotional flashbacks that feel really disproportionate and overwhelming, avoidance of intimacy or even overdependence on others, cycles of burnout, collapse, and even hyperproductivity. Body-based symptoms like chronic pain, fatigue, IBS, autoimmune issues might also be present. Why? This is because long-term trauma dysregulates the nervous system. Our limbic system becomes overactivated, constantly scanning for threat. The amygdala is constantly looking for danger, whilst the prefrontal cortex, responsible for problem solving, context and meaning, goes completely offline. In other words, your body doesn't feel safe even when it is. And this can keep you stuck in fight, flight, freeze, or a fawn response, even after the trauma has completed and is over. What treatment approaches actually work for C-PTSD? Well, C-PTSD requires a phased, body-informed, relationally attuned approach. And this is often a three-phase model that's been recommended. So phase one is stabilization. So this is where you build safety in the body, you develop grounding and emotional regulation strategies, and also you're cultivating a strong relationship with your therapist, a trusting relationship. Phase two is the trauma processing. So we're working gently with the trauma memories and parts work, and we're resourcing the nervous system to stay within our window of tolerance. And phase three is integration. This is you reclaiming your identity, strengthening your boundaries, relational skills, and your sense of self, and this is where you move from survival to connection. So what therapy is best for C-PTSD? Well, evidence-based treatments include EMDR, which is eye movement desensitization and reprocessing, trauma-focused cognitive behavioral therapy, somatic body-based therapies, internal family systems, and inner child and parts work. So combining relational, somatic, body-based, and attachment-focused therapies is often most effective. This is because we know talking alone isn't enough when we're working with trauma, because trauma is stored in the body and our emotions, and it must be released gently, over time, and in phases. So is healing from CPTSD really possible? Yes. Healing is not about forgetting or fixing. Healing is really about reclaiming your sense of safety, reclaiming your sense of self-worth and connection. You deserve to feel at home in your body, to feel safe in your body, to trust your inner wisdom, your inner compass, and to live without fear as your default setting. If this resonates with you, you're not alone, and you don't have to do this alone, and there's so much support available to you. If you're ready to connect with a professional, you can find me and other qualified professionals on Counselling Directory. My approach combines EMDR and parts work with mind, body, and emotion-focused techniques. This supports the nervous system, allowing for deeper emotion regulation and trauma resolution for a longer-term healing. Where necessary and if required and if requested, I also use energy work and hypnotherapy to help you gently shift from survival into deep restoration. Thank you for your time. Please reach out if you have any questions.